Thanks very much. That is startling. And I will tell you that what I have heard from governor staff going back months, even years, and this has been a central theme. And it has always frustrated me because of the education I've received from our members at UUP at Downstate and at Stony Brook and Upstate, the other SUNY teaching hospitals, that SUNY and the SUNY leadership and governor staff will always revert to, oh, but we want to save the medical school is great. We're going to take care of the medical school, as if it's possible to separate them completely. And it as you have all heard, just in those last two panel members discuss it, would have devastating effects. And I will say this, when I was informed of this plan and I challenged the chancellor, I asked him directly, where is there another case that you can point to where a standalone medical school without a teaching hospital, how has that gone? How will it go? There is no plan. They cannot answer that question. So thank you, Randall, for bringing that up. I want to take a break from the questions right now and from the panel because we are joined by Assemblywoman Jamie Williams, and her hand is up. So I want to give her a couple of minutes to speak as she represents Brooklyn in the Assembly and is a strong ally of healthcare and of the work our members do in UUP at Downstate. So Assemblywoman Williams, thank you for joining us, and you've already unmuted. Go right ahead, please.
Thank you so very much. And I just wanted to emphasize, and I know Senator Myrie spoke, and I thank him for his devoted, endless advocacy. SUNY Downstate, it's relatively close to me and personal. My mother-in-law worked the night shift at Downstate for 14 years. I picked her up almost every single night for those 14 years. And I know the critical role that you guys play and how vital you guys are to that particular community. And I always say that something like healthcare, our hospital, should never be at the table for a discussion to close. This will not be the same for Maimonides and for many others. Even though Downstate is not in my district, I do have constituents who do work at Downstate. And I know the vital role that you guys serve with the educational piece and how you guys serve as a very important place for rehabilitation. So I thank you and everyone here on this Zoom for your service and your commitment. And I am with you 100%, and whatever I can do to ensure that SUNY Downstate stays open, please don't be afraid to reach out. And I will be working with Senator Myrie to do as best as I can to help you guys. So thank you.
Thank you very, very much, Assemblywoman Williams, for your staunch support and your advocacy for those who live in Brooklyn and for healthcare. Thank you so very much. Turning back to the panel, I'm going to go to the first two panelists and ask about the impact on medical education, which our panel kind of split the first question really well, made it very interesting. Hopefully it was for me, it certainly was. But I'll go to Dr. Clare and then to Michael, and I would ask you both to pick up where Randall left us, which is what will be the impact on medical education, and be as specific as you would care to be, but this is a central issue, given the fact that the governor has highlighted the lack of healthcare professionals and a shortage that's going to get worse. We're trying to induce people to come from out of state to work in New York State. This is a long-term crisis in healthcare. And so with that, I'll turn to you, Camille, first. Go ahead.
Yeah, thank you, Fred. I mean, as Dr. Dresner alluded to, in my own department, I have a core residency program of 6 residents per year. As mentioned, I also have a gynecologic oncology fellowship of a total of 3 fellows. My fellowship, actually, my fellows could no longer, rotate at Downstate because of lack of investment in gynecologic oncological services here. So just in terms of historical background, as I mentioned, my fellowship is one of the oldest in the country. Dr. John Boyce, who's a past chair of Downstate, was extremely innovative in all the work that he did in our community for cervical cancer, which was award-winning and groundbreaking. And he's actually one of the founding fathers of gynecologic oncology. And so my residents having exposure to that level of education and teaching and being responsible for caring for patients that they're extremely deeply passionate about would be devastating. I train a diverse population of trainees, as well as over 200 medical students that rotate through my department learning about obstetrics and gynecology. So regardless of what they ultimately do for a living, they're exposed to this critical information that impacts the care that they're giving. We've already mentioned that we've trained most of the doctors in New York State. And so just not having access to that educational mission, especially in my field where there is a physician shortage in the state of obstetricians and gynecologists. There are multiple counties throughout the state that do not have an OBGYN at all to take care of them. And that's really impactful. Most of my colleagues that I train ultimately stay in the state to continue to offer care throughout the state. So I can't emphasize it enough how the loss of this department and this hospital would be devastating just for the patients that we care for every single day.
Thank you very much. Dr. Augenbraun.
Yeah, along the way, one of my other jobs that I performed years ago was at the clerkship director for the internal medicine clerkship for medical students. And I was the director of the committee that represented the clerkship director. So I know something about the medical education infrastructure. And I think the people that are proposing this plan to close the hospital don't understand the complex web of dependency that the hospital plays in both the undergraduate and graduate medical education. And I fear that it's almost like you start to pull on a thread from a suit of clothes, or a jacket or something like that. And before you know it, the sleeve comes off after a while, then the lapels come off, and then the whole thing falls apart. 30% of clinical rotations, as I understand at any one time for the medical school, take place at Downstate. Where are those students going to go if Downstate inpatient disappears? That much, if not more, of the teaching in terms of lectures are provided in the first 2 years by clinicians who work at University Hospital. Where is the replacement for that if we close the inpatient service and people go to look for jobs elsewhere? I can tell you again, working with other hospitals in the borough for the educational efforts, the affiliation contracts, so on and so forth, that other institutions have other priorities, and they don't have skin in the game when it comes to our students. They will say that they will take our students, but they will not commit an enormous amount of resources to provide the sort of intensive medical care. So I just don't see how you could consider this as a viable plan. I mean, it really would trash the educational enterprise, as far as I can tell.
I'm sorry when I hear you all speaking this way, and I've heard others say the same thing. I see this, and I'm not a conspiracy theorist, but I see this as a pathway that will lead to, at best, a radical downsizing of this important medical education facility institution, and either it being sold off to some other institution or closed. And that terrifies me for many, many reasons, angers me too. Camille, you had your hand up. Did you want to jump in and make a comment? And go right ahead.
Yeah, I mean, the only other thing that I was going to add is that, you know, I'm going to say specialty focus because that's what I've committed my life to doing as an obstetrician and gynecologist and as a medical educator for almost 27 years. I would say that definitely that commitment to educating our students and our residents and our fellows in our fields are just so critical, again, to impact the physician workforce that is so important. In addition, we also have other specialties that rotate with us. For example, we have one of the oldest midwifery schools. We have a PA program. We have nursing students that all work with us as team members. We provide services through our doula support team. So all of those members of the team are really impacting the care that we give. So the loss of University Hospital at Downstate will mean not only ourselves as physicians, but our other colleagues in the healthcare team will not have a place to get their education. And we also educate nurse practitioners within my department. So all those team members would not have access to the medical care that we're able to offer our patients.
And I'll just mention on a personal note, you mentioned nurse practitioners. I live in Schoharie County, an upstate rural community where there are vast healthcare deserts. My primary, and she's fantastic. She's been my primary for 5 or 6 years. She is a nurse practitioner. There are so few primary care physicians where I live, but the work she does, and both for me and for my wife, fantastic. She's a great caregiver. I wouldn't trade her for anyone, but again, it points to the training that's so necessary. Dr. Dresner, you had your hand up. Did you want to jump in?
I just wanted to point out that some people would say, oh, why can't the students go to Kings County Hospital to train? And while the residents may be going to Kings County Hospital, students cannot go to Kings County Hospital because private equity in the term of offshore schools have purchased spots in local hospitals, including HHC hospitals, and that has pushed out the state-funded U.S. trained medical, U.S. Accredited medical schools.
Thank you for making that point. That is so important, and it is something that I didn't know about till I came in as UUP president in 2013. And we were once again fighting to save Downstate. Cuomo eventually backed down, and that's when I learned about the difficulty in finding placements because of the offshore medical schools and utilizing funds in such a fashion that our residents were locked out, and that again is going to obviously impact the healthcare. But thank you. Please.
By the way, Fred, the use of the offshore students is sanctioned by the state of New York, ironically, so that, you know, here we have a state institution that's competing for clinical spots in places because of a program set up by the state. It doesn't make any sense to me.
No, it doesn't. It doesn't. Thank you for pointing that out. Dr. Barbour, go right ahead.
Yes, well, okay. So again, I'm not a clinician, but I thought it was useful to get what I consider to be an unbiased but yet informed opinion from GPT. And the question I posed is, what is the expected impact of a permanent closure of the primary teaching hospital for an academic medical center? And this is the response. The permanent closure of a primary teaching hospital for an academic medical center would have significant and far-reaching impacts on various stakeholders, specifically with respect to medical education. One of the most immediate and critical impacts would be on the medical education. Teaching hospitals are essential training grounds for medical students, residents, and fellows. The closure would disrupt clinical rotations, hands-on training, and the exposure of medical trainees to diverse patient populations and complex medical cases. This would impair the quality of medical education and the preparedness of future healthcare professionals. And I'll also add, I know that a fact that's relevant here is that the American Association for Medical Colleges in 2022 determined that over the next 9 years, 40% of the healthcare professionals in this country are going to retire. And given the fact that Downstate is a large medical school, you're now adding to that the likelihood that there'd be a significant impact on the training. If the medical school closes, it would be just unimaginable. You could quickly set up a situation where you're effectively guaranteeing a cascade of actions.
Randall, what was the year that study came out in terms of the 40%, which I knew about?
2022.
2022. Was that factoring in those that were we were anticipating leaving because of the experiences of COVID?
I honestly, that I couldn't speak to, but I know that's what I read, and it's been announced.
Yeah.
Fred, I just want to say to answer your question. I mean, I think it's a compounding factor. The impact of COVID, burnout, an aging physician population, more risk of mental health concerns, I think all of those impact the future physician shortages, of which is really going to be profound in my field, as well as many others, as already alluded to. So it's critical that we continue to educate our students and our residents and trainees.
Thanks very much, Claire. I'm not sure. I think, well, several of you have mentioned the important research being done, and Randall, you highlighted the impact of the development of MRI technology. I want to, it's a multi-part question here, because each of you have raised phenomenal points, but in different areas of focus that are all important. I want to give you the opportunity that if you had 3 minutes to talk to the governor of the state of New York and express to her a particularly damaging impact that the closure would have. If you want to talk about research, because we've mentioned it a little bit, you want to go further into the research angle, that's fine. If you want to talk about specific health conditions, the chronic conditions that have brought a lot of harm, obviously, in Brooklyn, and particularly in African American and also Latino and indigenous communities. The other area, and I guess I'm looking at you, Dr. Clare, specifically, that the governor has made it a point. She issued a directive a few months ago about highlighting the importance of addressing maternal mortality in the African American community. I guess and also emphasizing the importance of reproductive choice for those in New York State as opposed to other states. I've talked to students, I've talked to residents, and who happen to be women, who have talked about the fact that they are very concerned about the continued access to abortion as a means of addressing health choice, and how, and indeed, I was at a panel at SOMOS, a gathering of legislators and interest groups and interested individuals just a couple of weeks ago. And these two students who were at the Einstein School, I went up to talk to them afterwards, and they saw my button and they said, yeah, we're very concerned about the closure of Downstate. And they were talking about training and access to abortion. So I'll lead with you, Claire, and then we'll go around to everyone to talk about, if you want to talk about research and so forth. But what would you say to the governor of the state of New York as she continues to hold fast to this proposal?
Well, thank you, Fred. I mean, actually, we received funding from the governor, from the state, to expand abortion access at our facility. We were one of the hospitals that were chosen to receive that funding. And what it allows us to do to expand the opportunities for not only educating our residents and our trainees, but continue to offer these services that are so critical. Abortion is healthcare for our patients. And so that's so super, super important. As again, we're responsible for educating those outside of the state as well. Thank God we're still a safe haven state, and until we're no longer, we're able to provide those opportunities outside of the state and for training individuals. In terms of research, I can tell you my own department, we received a huge grant from the Patient Centered Outcomes Research Institute, PCORI, to work on equity in perinatal mood and anxiety disorders. And so having that opportunity allows us to, again, not only improve what we know in this area, but to provide our knowledge for the patients that we care for. Mental health conditions is one of the top 3 conditions that impact maternal mortality and morbidity, fresh off the presses from the New York State Maternal Mortality Review Board for 2018 to 2020. So this is kind of information, and these are the services that we need to continue to provide. We also do work on patient safety bundles, for example, as part of the Safe Motherhood Initiative, which the governor has funded in her budget that we need to continue to fund. Again, OB hemorrhage, thromboembolism, again, 2 of the other top causes of maternal mortality and morbidity. So again, as you mentioned, it's all related. It's part of the governor's plan. Do not do this is what I would tell her in the 3 minutes.
Thank you very much. Yeah, it wouldn't take 3 minutes, would it? Just don't do this. Yeah. Mike, we'll go to you.
I mean, research-wise, it's innumerable in the 70 years that the medical school has been here, the number of things that have come out of the school. I mean, I'll just remind everybody that the MRI was first developed at this institution. We have a Nobel Prize laureate who worked at this institution for many years. In the early days of the AIDS epidemic, this institution was critical in providing guidance for the care and management of patients with HIV through research programs. Sickle cell disease was another disease entity for which we provided a lot of research. I don't know what would happen to any of this if the institution went away. And I think all those clinical issues need to be addressed if the institution went away. And since you brought this up, I was thinking about other clinical areas that really need attention. And one of them that I think in our institution that's critically important is the care of patients with diabetes. This is a plague that is a little bit under the radar screen, but has so many implications for cardiac disease, for neurologic disease, for renal disease. And if anything, this community needs tons of resources invested in managing a center of excellence for diabetes care right now. Pulling out is not a good idea. I mean, it's just going to exacerbate all of these complications. We'll have more people on dialysis, more people needing revascularization procedures, which they can't get here right now because the program for cardiothoracic surgery was closed down. I would actually say to the governor, let's twist this picture around and say, you need to fund this institution more, not just keep it open. We need a brisk infusion of resources in order to provide the services that this community needs.
Well stated. Absolutely on target that there needs to be more investment in this institution, because we all need to remember that going back to the early years of Governor Cuomo, he was cutting funding for the 3 SUNY hospitals, targeting downstate most aggressively. And when we hear the chancellor and sometimes even the governor and the governor's staff, although she hasn't said anything publicly, she is privately, oh, the financial situation at downstate is terrible. It's just terrible. 2 points to that. One is, yes, that's what happens when you have a public institution that is underfunded for 10 years. And second, as I have said directly to members of the governor's staff, if you get rid of this, and to the chancellor's staff, if you get rid of this hospital, where will depending on whose numbers you're using, the 200,000 to 400,000 patients that are treated every year, where will they go? Though 90% of the patients at downstate are Medicaid patients, they're not going anywhere. They're going to need health care, and the state is going to have to provide it. If it's not at downstate, they're going to have to subsidize private hospitals elsewhere in the borough. It's still going to cost money. Why not keep the public hospital open? It is a teaching hospital. Anyway, that's my rant for today. I'm sorry. Lisa, let me go to you now, please.
I think the thing I wanted to talk about related to devastation is the loss of the transplant unit. The reason I want to talk about the transplant unit is it's an example for graduate medical education and undergraduate medical education, meaning medical students, in that what happens when one service is gone, then there's a cascade. It happened with the loss of radiation oncology. We did not replace our linear accelerator, and we lost the training program in radiation oncology. But we then lost the ability to train OBGYN, GYN oncology is part of that, hematology, oncology, pediatrics, a whole downstream effect with the loss of a service that was done because of inadequate funding. And the transplant service is unique and serves a population that is otherwise profoundly underserved. People don't want to there's a very difficult patient population to take care of. And we have a highly effective functioning service, which would impact infectious disease, nephrology, urology training, and downstream effect. You also cannot bring, I also want to talk about the idea of an academic medical center. Academic medical centers are created and funded by states across the country because they take care of patients that other places cannot make a lot of money on. And by putting and they hire physicians who are concentrated on education, research, and clinical care. Okay, you don't have that at a teaching community hospital. You have clinicians who want to take care of patients. So this combination, we take care of patients that no one else really wants to take care of. We take care of patients who are no one else funds fully, and we provide the education and the for innovation. And also, I know that I'm disjointed. We also provide our trainees with experience in taking care of underserved populations. When you go to Memorial Sloan Kettering, you're not taking care of underserved patients. You are seeing state-of-the-art cancer care, but you're not learning the impact on underserved populations. And what we need in this country is more physicians interested in learning and taking care of patients who are underserved, to level out the care of healthcare in this country, the quality of care in this country.
Extremely well put. I'm really glad you addressed the loss of the kidney transplant center, the service, the only one in Brooklyn. And, and sometimes we've heard, well, maybe it'll move here or move there. Lives are at stake, but also thank you for pointing out all of the downstream effects, both in education and in healthcare. It's vitally, vitally important. And as I think about it, in terms of the impact on the community, Christy is going to put into the chat now. I just remembered, Christy. We want to make sure that the community is heard and their concerns are preeminent. And so on Friday, there is going to be, and this was put together by the community itself, ministers are involved in it, community groups. There's going to be a community forum on Friday at 5 p.m. At PS 235 Janice Marie Night School, right on Lenox Ave. And you can register or you can simply show up on Friday at 5 o'clock. We have about 2 hours there. There's going to be leaders of the community, political folks are going to be there, simply to hear from the community. And all of you are certainly invited to be there, to be heard, so that, again, we continue to raise the voices of Brooklyn so that the governor hears the dramatic impacts that such a closure would have. And now I'll go to Randall. Please go ahead.
Yes. Okay. So, of course, the closure of the hospital would have a profound impact on research, certainly would influence some of the things that I'm trying to do. But I do want to highlight another group. This is the Henry Begleiger's group laboratory, and they've been doing work on genetics of alcoholism and related drug influences. I think you would end up disbanding that team, and this is a team that's been working with multiple universities for decades now. And that would just be, it's not just a loss to Brooklyn, it's a loss to the country if you were to do that. Okay, but if I might just digress a little bit here, and because this is something I've tried to, I think, in terms of holistic considerations, and there's a thought pattern that's been going through my head, and I do want to share that. Let's be clear, this is a presidential election year. And I think it's fair to say that candidate Trump is not a big fan of New York. So now you have a scenario where it's wonderful, or perhaps depending on your views, the state of New York and the city of New York has elected to spend billions of dollars taking care of new immigrants of various kinds. But now we're faced with this apparently enough of a deficit or concerns of costs of running an academic medical center, the only one in Brooklyn. Consider the scenario where you now have a bank failure or more than one bank failure, which we know happens from time to time. But now you're setting up the possibility to linking that bank failure to the added stress that can come from destabilizing your healthcare environment. Do you really think if it becomes President Trump that he's going to be favorable to allowing the Federal Reserve to save those institutions? Why wouldn't it not be the case that he says, you brought this on yourselves, state of New York, city of New York, you pay for it. You pay the tens of billions or hundreds of billions of dollars it could be to take care of this. I honestly think that's a realistic possibility.
And it is. We oftentimes, and because we want to focus on the human costs and so forth, but the economic ramifications are absolutely of importance as well. Downstate is the fourth largest employer in Brooklyn. And remember, if Brooklyn was a city, it would either be the third or fourth largest city in the country. Depends on who I've heard from in Brooklyn. And I don't want to start an argument with my friends in Brooklyn, but I do want to say, let's be cognizant of that as well. And the one other aspect that again takes us into the political realm is, as folks in Brooklyn, obviously, I hope, understand and know, in the incredibly close gubernatorial race in 22, it was Kings County, the largest county in the state in terms of population, that won the election for Kathy Hochul. It was Brooklyn. And there were members of our union and other unions, but I remember walking the streets of Brooklyn the day before Election Day, trying to ensure that people got out to vote for Kathy Hochul. That message is being delivered as well, that it is important for all of us to respect the work that is being done, but also the work that was done on behalf of our governor. I think I'm going to speak for everybody who has joined us today that I regret the fact that we have come to the end of our hour together. And I know that everyone is busy. I want to be respectful of everyone's time. I want to first thank our staff. They're amazing in putting these events together. And also, obviously, most importantly, to our 4 panelists for the wisdom, intelligence, information that you brought to this gathering. Phenomenal. And again, I wish I could spend a lot more time just listening to you all and have this conversation go on. We are going to have another panel tomorrow evening at 5, different times period to take account of the fact people work at different schedules. But having said that, I want to thank the well over 100 folks who joined us originally. We've lost a few, but to those who stuck around and even those who left, I hope this was informative, but also energizing to do the work that has to be done. We need to be heard. We need to be heard in the Capitol. And in order to do that, please seriously consider getting on the bus next Wednesday, coming up to lobby, and then also join us on Friday. I'll be there. I don't have a role, but I just love going to Brooklyn and being amongst the folks who do the good work there. And again, thanks to all of you. Thanks for the good work all of you do who are working the life-saving work in education and research at Downstate. And I am confident and almost certain that we're going to win this fight because we have to. And so with that, thank you. Have a wonderful rest of the day, and we will see you down the road. Take care, everyone.
Thank you, everybody.